Hey, it's Steve Marshall in for Jenny D, sitting down with Dr. Pyle Kohli, the 9 News medical expert, and she's got the Cherry Creek Heart practice in Aurora. She's accepting new patients if you'd like to get a hold of her, and it's getting into wintertime. We haven't had any snow yet, but let's talk about sunscreen and stuff.
Yeah.
Now, as a guy, I will fully admit I do not really have a regiment. In the summer, I wear sunscreen, but in everything, I'm not really, I'll be honest, I'm not outside all that much, but what are kind of the going rules as we get into, because a lot of people think cloudy day, why do I need sunscreen?
Okay, so this is a huge, huge fallacy.
Yeah.
And I think especially for men, it's really important because of course, we know that it protects against aging. So maybe I'll appeal to your vanity here and say that wear the sunscreen to keep yourself looking younger. But if that doesn't work, we know that skin cancer per capita is one of the highest risks here in Colorado, especially because we're that mile high. And we know that, sun damage to our skin occurs from the UV rays and UVA and UVB. So UVB is the one that causes sunburns.
Okay.
And UVA is the one that usually penetrates deeper and causes risk of skin cancer. And we know that the sun doesn't have to be out for us to get UV exposure.
Right.
In fact, even on cloudy days, there's about an 80% UV exposure. And in the fall and winter, as the temperature changes, sometimes you have less ozone protection. So you can even get more UV exposure then. And then if you're skiing or up in the mountains, even on a cloudy day, we know that the snow reflects the UV.
That was my next question.
Yeah.
I had heard that at one point, so that's true.
It's very true. And so you're essentially talking about a mirror kind of concentrating the UV towards your skin. So it's really important to protect your skin. And you can obviously, Steve, do it with clothing. If you're not someone who loves to wear sunscreen, you can buy those UPF clothing or the wide brim hats that protect you. But I really do encourage you to wear sunscreen because it is so important. By the time you get a sunburn, or you start to have wrinkles, that means it's almost too late.
Yeah.
The UV has damaged your DNA, and your body is essentially responding to it with an inflammatory response.
Now, are there any products you recommend or an SPF limit? Or let me ask you this, since I read somewhere where anything over an SPF 50 is kind of pointless because it doesn't really do any extra good.
So, I mean, yes and no. So SPF stands for sun protection factor. So the minimum that you need on your exposed areas is 30.
Okay.
And you want to make sure when you're looking at that sunscreen, a couple of things. One is that it's combined UVA and UVB protection. And then you want to look at the type of sunscreen. So there's really 2 options here. One is called a mineral sunscreen, which is like zinc oxide, titanium dioxide. That's that kind of creamy, goopier stuff that sits as a barrier on top of the skin. So the nice thing about that is minimal absorption. It's really safe for kids. It's great for people who have sensitive skin, and nothing is actually getting into your skin. Because a lot of influencers online are starting this misinformation or disinformation that sunscreen causes cancer because you absorb it in your skin and it causes hormonal disruptions and leukemia. So that's only partially true because the chemical sunscreens, the ones that dissolve into your skin, they do absorb into your skin, but the amount that you would need to cause hormonal disruption or to cause cancer is far more than what we find in sunscreens. And in fact, not wearing sunscreen causes cancer. So that's a really important distinction. So if you're afraid to use the chemical sunscreen because you're worried about...
Is that more of the spray ones that you're talking about?
These are the spray ones, and these are the ones that have avobenzone in it. So if you look on the back of the label, most of the ones available at Target, the Banana Boats and all those, they're chemical sunscreens because they absorb and they don't leave that kind of white residue on your skin. But I use a mineral sunscreen. That way I don't have to worry about it absorbing. The downside of the mineral sunscreen, a couple of things. One is that I have darker skin, so it can leave a little bit of a whiteness residue on your skin. And you really have to rub it to sort of get a nice, even layer. But I love using that, on my niece and nephew when they come to visit. And I love powder sunscreen as well. That's another great way to just kind of coat the top of the skin. So now you can get a lot of mineral sunscreens and powder. So if you don't feel like you want all that residue, or if you're a woman who's wearing makeup, you don't want it to affect your makeup, you can just kind of put a layer on. But you have to wear at least the SPF 30. Once you get to over 50, sometimes some of them are even 70, you start to have diminishing returns on your investment unless you're spending a lot of time outdoors. So let's say you're going skiing one day. You want to make sure you have the highest protection because you're spending a lot of time outdoors. You're probably out there for 70 minutes or longer. But if you're just going to be in and out, walking to your car or what have you, you can probably get away with 30 or 50 on your face. Now, the higher the SPF, the more the protection of the skin, the less likely the rays are to penetrate, the less often you have to reapply the sunscreen. And so it helps if you're not somebody who wants to put another layer on every 2 hours.
I was going to ask you about the time frame because I'm not somebody that spends a lot of time outside. It's usually just in and out of the car, buildings, things like that. But you're saying minimum 30 just to be on the safe side.
Yes, and I'll say one more thing is that if you're sitting inside and there's a window, glass does not take care of UV light.
Cars, when you're driving.
Cars.
That's,
Yep, so left-sided skin cancer are very common in Colorado because we're sitting in our car. We get exposure on the left side of our face. Now, the car windshield does have a UV blocker in most cars, but the side windows don't necessarily have that.
Right.
So when you're talking about your left arm or the left side of your face, and you're saying, I'm not outside, well, in a way, you're still getting exposure to that UV. So I want you to be really mindful of that.
It's good to know. Yes. I know. I love having you in because you always teach me something, and then I always leave here going, all right, I have to start adopting that. So, ladies, a lot of you are already doing this. Guys, we need to make sure we do it too. There's no shame in that game, brother. You don't want to get sick. So.
No, and I will say one more thing, which is that as the winter comes, a lot of women and men too should evolve their skincare routine as well. So in the summer, we tend to use lightweight moisturizers. We tend to use more SPF. We tend to cleanse more because we sweat more. There's more oil production. In the winter, I want you to have less cleansing. I use a gentler cleanser, one that's not as exfoliating because your skin is going to be drier. And there's going to be less, obviously, moisture in the air. And cold air can be really drying to the skin as well. And you want to use a heavier night cream and a heavier day moisturizer as well.
Excellent. Doctor, thank you so much for coming in today. I appreciate it.
Thank you, Steve.